Welcome to Health Systems CIO's interview with Eric Jimenez, CIO at Artesia General Hospital. I'm Anthony Guerra, founder and editor-in-chief. Eric, thanks for joining me.
Thank you for having me on your show.
All right, very good, Eric. You want to start off by telling me a little bit about your organization and your role?
Yeah, so Artesia General Hospital is a 25-bed rural acute care hospital with 16 clinics located in southeastern New Mexico. We have a main campus and clinics in Artesia, New Mexico, and then we have some remote clinics in a town about 30 miles south of us in Carlsbad, New Mexico. We provide a large range of services from family practice, behavioral health, endocrinology, cardio, ortho, pain management, podiatry, urology, um, oncology, or not oncology, wound care, hyperbaric um, services
Mm-hmm.
for our, and of course we have the traditional inpatient, ER, radiology, lab, all those different services a regular health system would have.
All right, very good. So, you're a rural, small health system. So you're facing some of the challenges that that group of healthcare providers is facing, and we'll get into that. Why don't you start off by telling me about some of the sort of the main projects or things that you've been working on in the last year or so, and then we'll go from there.
Yeah, so we just completed our build out of our new data center at the beginning of the year. So um, we were in a full hyperconverged environment, and we were running out of space and size for and storage and cooling. We're facing constant issues with our data center, and our executive team, decided, we had to make big decisions, in which one of them was if we're going to move to the cloud or stay on premise. And a lot of us, a lot of the executive teams believe that, staying on premise is still kind of the best roadmap for us. Being in a rural area, we do have limited internet connections sometimes, and that can and hinder patient care sometimes. And so we decided to double down and build a new data center that allows us to get prepared for the future. Um, some of the other major projects that we're working on is trying to, what our CEO tasked us as an executive team to kind of focus on how's artificial intelligence going to help us in the future. That was one of the things that he tasked all the different executives in their different levels. And of course, me being, the IT guy, I
Hmm.
was tasked to do that in a kind of figure out how to best make that work for our organization. And so, a lot of that, you know, we always have to look at it from, the um, we have to look at it from a different manner as far as um, you know, the triple aim or quadruple aim type of mentality on how, and that's kind of where I kind of want to kind of focused on over, we look at that triple aim, triple arm of care and trying to how to figure that into our mix of our IT strategy.
Mm-hmm. Yeah, they assume you're the AI guy and you're gonna know it,
Yeah.
like Elon Musk,
Yeah.
right? But I think so in your situation, every healthcare system, you're trying to do the best you can with what you have. Everybody says it's tight in healthcare all over the place in terms of margins and costs. You have to watch your expenses. In IT, you're expected to, um, bring in solutions that are going to save money, even though they cost money to bring them in. And AI is one of those things that people hope or assume or think might be what saves them. It's what's going to make us more efficient and save us. So how do you go about figuring out right now where AI might help the health system? I mean, and this is a classic sort of dynamic in IT leadership is how much do you lead and bring ideas to users and how much do you let ideas and requests bubble up from users? It's got to go both ways, right?
Correct. Yeah. And I mean, that's a good statement. I think one of the big thing that our CEO brought up to me was a video of a health system in Florida, and he spent, he's talking about in that health system, they're talking about pajama time, and so they're focusing on how can we improve physician burnout, how can we improve that pajama time. So he shared that with the executive team, and I was just like, okay, I see what he wants, I know what he needs, and of course that the program that was being um, highlighted in that was Dax Copilot by Microsoft Dax Copilot. And so how can we bring that environment in here? So we went to Microsoft, tried to figure out how to partner with them and how to get them in our environment. And so there's a cost associated with it. And so once we vetted them, looked at different models, different vendors, we went down the proven track because Dax Copilot's been kind of the leader in the industry. We could have got a startup, and those startups could cause some problems down the road, but that's why we went down the Dax Copilot side of things. And what when we implemented it, we're starting it, of course, everyone wants the tool right away, but we wanted to make sure we implemented in a pilot program, take 10 physicians and walk them through the year and see how that it improves their workflow. We had a new provider start recently with us at the hospital, and he was struggling with our technology. And we said, okay, hey, I know it's one more piece of technology, but let's add it into your workflow. Let's see how it improves your day to day. And, he went from, you know, seeing about, 5 to 6 patients to seeing back to his full workload that he was doing at his previous place, because he didn't have to sit there and remember, you know, okay, I got to document, and he said that now that he's got the flow understood of how the electronic health record works and DAX on top of it, he's just seeing a great improvement in his day to day. He's not staying late, he's not working, not using pajama time to do that stuff. So that's kind of what we try to tackle in our environment, try to find use cases for artificial intelligence. And so that was one of the use cases that we implemented for artificial intelligence.
Very good. I want to go back to what you were talking about with the CEO, and how your CEO said, "This is a concern of mine: burnout, clinician satisfaction, clinician happiness. Go do stuff that makes this better." Right? I mean, it seems to me like that's critical to get that kind of messaging from your CEO. Like, what do you want me to work on? Like, are you, and hopefully you wouldn't get someone like this, but you might have someone who says, I want you to spend less in IT, right? That would be a nightmare scenario, but you could have someone who says, that's what I want you to focus on: spend less money. But
Yeah,
you had someone that had a focus of, here's what concerns me. Now you go figure out how to make this better. So that helps, right? As a leader, like, where do you want me to go? What do you want me to focus on? What's our strategy? And now I'll go execute.
yeah,
Correct?
correct. I mean, we're blessed because our CEO is also a practicing physician. So for him to, the pains of the struggles and everything that a physician has to go through, and that's kind of where, we look at it from our kind of strategy in our future plans, for our hospital, is how do we improve the patient journey? How do we improve the employee journey? On top of that, those are the main key goals that we're trying to figure out from that perspective. And so we focused on the provider side of things, and now we're focusing on of course there's more to come, with our partnership with TruBridge. I think that what they're working on in the background, that with artificial intelligence and how they're slowly working that through their systems, it will be kind of important to see how they're going to come out at how they're going to help us improve that physician side of thing. and from the employee side of thing. And so, we're looking, we're also tackling it from our perspective on the employee burden and how do we lessen that burden and, that cost. And so we're starting to look at technologies like RPA, so robotic processing automation, to help those frontline workers through their day-to-day job to make sure they're able to tackle, focus on the patient, not focus on, hey, did I check eligibility? Hey, did that patient get the right, did I get the right information from the driver's license? So we're focusing, we're trying to help that part of that burden on those employees.
So TruBridge is an EMR for the smaller health system. Is that how you would describe it? What's the best way to describe what niche they're the best for?
So they're focused on, of course they can handle multiple size hospitals, but I think their niche is at 50 bed and below. Uh,
Hmm.
Sort of like us, critical access rural hospitals that are focusing on, you get a you get a good product for the cost. You know what I mean? That's what they're good with. And our partnership with them has been, great. We migrated from multiple systems, paper processes into one health record. When, during that process, our goal was one patient, one bill. That was kind of our model for a long time, to handle that. And, TruBridge help us get there with that one patient, one bill type of format. In 10 years now, we have 10 years worth of data from the ambulatory side, because it was a all-encompassing solution from the inpatient side to our ambulatory side. So, we do have a lot of clinicians that do surgeries, and that's kind of what our niche is. We provide, great quality care um, for our community. And so a lot of our patients, they have their options to choose from. We have hospitals in the north of us. There's two hospitals to the north of us. There's a hospital to the south of us. They're a little bit on the bigger side, but patients will travel to come see our doctors from those towns. And so, we pride ourselves on that community and that excellency to, provide quality care.
So let's talk to your peers out there in of comparable sized health systems, and let's try and help them out. If you want to describe your search for a new EHR, you said you had multiple EHRs, you had paper processes, and you wanted to standardize. I assume you did a formal search and said, okay, we want sort of the epic for the small market, right? We want an inpatient, outpatient. We want a unified system. We want to get on one system. Tell me a little bit about the process of making that selection, involving users, however you did it, with an eye to your peers who may be in the same position and about to go down that road.
Yeah, I mean, the best way to put it's not an IT project, it's a organizational project. And sometimes in our rural areas, we have to wear multiple hats, and that, of course, that's where that process, I would advise, don't tackle it as a IT project. It's an enterprise project. Everyone has to have buy-in, from the executive team to the med staff to the directors. Everyone has to have the buy-in of that solution. Lessons learned that I've learned from the implementation of of TruBridge at that time. If I would advise myself 10 years
Yeah.
ago, I would say take your time.
Mm.
Don't rush the process. And that's one thing that, we kind of did, and we wanted it. Our organization at the time needed to replace our electronic health record because we're banging against meaningful use. And so, 10 years ago, that was the big thing, to make sure that we were part of that meaningful use money. Now, it's still important, but now it's, looking for the efficiencies, looking for how a solution can help you, that patient, go through, from that patient journey, the importance of understanding that from every side of things. That's the key element of a good implementation. So that would be my advice for my peers would be understand the patient journey and understand the employee journey through that through your health record.
What would have been better by not rushing it? Would have been more time to sell it, so to speak, internally and the benefits to the users? Is that what more time would have afforded you? Or you tell me? You said more time would have been better.
I think you know, we were ambitious and we implemented a single solution, big bang type of thing within 90 days. From the time we signed a contract to the time we got it in place, and it was a 90-day window. And I think the big thing is it's more than just 90 days. You know what I mean? It's the understanding your processes, understanding your patient, your workflows, understanding, it's got to be a mirror of technology and process together. And sometimes, what exists won't work in the future. And so you have to augmentate that and get that to a better, nice, cohesive um, process that will mirror the new way and help improve things. And I think that's what happened is, if I look at that past was we just try to take the old bad process and just put technology in place, and that doesn't work well. And and we've learned for the past 10 years that there was a problem with the technology, and then we would go back to our vendor, we would go back to TruBridge and said, hey, we need this improved. They would come back several months later and said, hey, here's what we got. So
Let's talk about understanding workflows as an IT executive, and the importance, if you're going to lead IT, of really understanding clinical workflows and the needs of your users. And when you run any type of health system, they're very diverse because there are many. You mentioned them in the beginning of this interview. There's a whole number of specialties. There's inpatient. There's outpatient. There's many users. You have many users that all have their own specific workflows. So it's critical, and you tell me if I'm wrong, it's critical when you're leading IT to understand as much of that as possible and make that a continual education journey and get out there and see what people are doing and understand to the best of your ability what they're doing because it'll help you be a better IT executive. Does that make sense?
makes sense, makes perfect sense. And I mean, like I said, you know, I don't like talking about myself and my journey through being where I'm from. That was kind of my big thing is, I'm not a nurse, I'm not a doctor, I'm not a lab tech, but I want to know what you do on your day-to-day basis to best understand how I could deliver technology to you. You know what I mean? And how can this piece of technology help you improve your day-to-day work? And so that's kind of where, you know, I always start something is, when I look at a piece of technology, I look at it from that workflow. How can we improve that um that with just that? And so, I like to roll up my sleeves, get in there and, go through that patient journey. Understand, when I go through as a patient, I want to sit there and understand, hey, what is that person doing on the computer and why is it
Mm.
taking so long? And so I look at it from that lens, and then I put it in from the employee lens of, how does that workflow go through, and how do I tackle this? How can I improve, you know, that that process? And so that's kind of where I get involved with, and sometimes I get stuck in the weeds sometimes, but sometimes I got to wrangle myself out of it and think of that big picture or what we're trying to do, you know.
That's all really good. When you're trying to ask questions and learn workflows and, tell me about your issues, tell me about your problems. Is that always well received, or is there a way to do that and screw it up? And I'm thinking probably not initially, but I'm thinking if you do that, if you do get in there and ask questions and the clinicians give you their time, and explain things to you and nothing happens, the next time you go back, they're going to say, no, I gave you an hour of my time. I told you everything and nothing changed. So if you're going to ask for their time so you can learn their workflows, you have to show results. Does that make sense?
Makes sense. Yeah, it makes perfect sense. And I think that's where, you know, we're looking at right now. Where that's kind of where we get the question, because that was kind of the when we start this journey about RPA, and we're sitting there, we're sitting with patient access, and we'll use that example as this process of sitting there and trying to improve something. You know, we're still at the very emphases of gathering the data, and so we're
Hmm.
asking, hey, walk us through this process and walk us how you go through our electronic health record, and make sure we know and have a good understanding of how you do the boxes. And we what we try to do at the beginning always you know start with that why are we doing what we're doing, get them to understand, hey, we're going to tackle this is why we're doing it, because we're trying to help you during your day-to-day burden and get there. And so when we did that when we're doing that with the RPA process, that was kind of the understanding that, hey, this is why we're doing this, so you could focus on patients, and that's ultimately what the end result is. And so how that's going to come out is kind of hoping to see how that comes out. And with the clinician, with the providers that we implemented Dax, they saw the return on investments of, hey, yes, you have this phone with you, this workflow is still needs to, we still need to figure out this workflow. And seeing that example from that provider improving his day-to-day workflow has been great.
Excellent. Very good. The why helped you get their time, right? Because these are very, very busy people. And sometimes they may not be that receptive to, hey, I need you to join this committee or I need you to sit down. They may say, I don't have time. I have to see a zillion patients today. And you're too, by the way, your tools are slowing me down and I got to do all this documentation and I want more pajama time. And you're like, but I can't help you unless you give me a few minutes. So tell me about that. And you said you start with the why. I'm guessing that's part of what will get them to agree to sit down with you.
Yeah, and I think getting them to start with the why, but it's like you said earlier, that return on investment, you're selling them on a dream, a kind of a possibility that could happen if we partner together. And
Hmm.
that partnership is key, because I give them the why, but also understand that there's a partnership that has to be associated. There's a little give and take that has to happen, and it's not always going to be perfect. I could tell you, with our partnership with TruBridge, it's never been perfect, but there's always that give and take. Hey, we
Hmm.
need you to improve this. TruBridge would, and I think that's where that clinician, as things got improved, there's always that give and take. Hey, I helped you improve your process. Let's have this new piece of technology that I need someone's personal, your feedback on to
Mm.
improve. How can I help? How can we get to that happy medium? So um, that that's kind of where we try to do, is just give them that, try to get that partnership in place.
Excellent. I want to shift gears in the few minutes we have left, talk a little bit about cybersecurity. It's constantly discussed as sort of a pain point for rural health systems that just having the expertise in house, having the resources and the money to combat what could be nation state actors is just not a winning proposition. And the government needs to do something to help out small health systems. And I thought of it when we were having our earlier discussion about your CEO saying, clinician burnout, pajama time. I want this to improve. Um, Cybersecurity is an area that it has to be good. So it's not even like it's got to be mentioned, right? Well, I mean, I guess you could have a CEO that emphasizes it, but we assume everyone is saying that's like stakes to play. So it's like, Eric, whatever else I tell you to work on, yeah, it's a given that's got to be solid. So how do you handle it? How does a small rural health system handle cybersecurity as well as possible, as well as you can?
I think it goes back again to technology. Um, and again, I'm blessed because of our leadership. They've always given me the ability to purchase the right technology and making sure that technology gets implemented. There's also partnerships with, great partners, your VARs that you partner with. I think those play a key factor into it. But again, it truly falls back on the individual. Even though, I'm going to say, hey, I got to put my cybersecurity hat on, or my CISO hat on this week, and I got to focus and heavy down on making sure that we're protected from an organization. Um, you know, uh, as a CIO, you have to be ahead of the curve. You can't be always okay. Be reactive. You have to be proactive. How can I improve this workflow? You got to find those tools and grants and projects that are out there that allow you to learn something from out of the whole process. You know, I think Microsoft and Google given us the ability, to help rural hospitals out, but also being able to have that uncomfortable talk with your CEO says, hey, or your CFO to say, hey, we need to invest in this technology because it's either that or we're going to have to invest in people. And so there's like this fine mirror of technology and people that you have to balance that out. And so, I think one of the big thing is, for the longest time, I focused on putting the right tech in place. And now I'm focusing on making sure, hey, I'm able to man that tech to the best ability with the right people. And
Hmm.
finding those right people in rural America is very hard. So you got to sell them on a dream. You got to sell them on a challenge.
Hmm.
Find the right people if you sell them on the challenge, because there's always going to people out there that they don't care their environment around them. They just want to be challenged and work. So
Well, that's awesome, Eric. We're just about out of time. I'll just ask you one final question, um, and I'll frame it up as in asking you to give your best advice to someone in your position at a comparably sized health system. So, Eric Jimenez in Florida at the same health system. What's your best advice to that individual on how they should handle their business to be successful?
always be a student. Never never let your ego get in front of you. Always be ready to learn something new, because like I said, that without that ability to understand, the ability to constantly be on a learning, and your ideas will never always be the right ideas. They might get you to point from point A to point B, but always be open to other people's ideas, because that they might be able to spark something that will lead you down another path. And so that I think that's what I love to go when I go to conferences and I meet different people from different health systems, and we all talk, from large health systems to small health systems. We all have the exact same problems. It's how we handle it and how we do things internally. And so I think, if I would give anyone an advice, is be a student, always be ready to learn from that.
That's wonderful, Eric. That was great. I want to thank you so much for your time today. I think our listeners are really going to enjoy it.
Well, thank you.